Hi, I'm Ross Maynard from the NHS Time for Care project. This video is about dealing with angry patients in primary care. I hope you find it useful. We all have the right to be angry at times. The truth is that anger is a normal and fairly common human emotion, and in general practice it's inevitable that you're going to have to deal with agitated patients from time to time. The 5 key learning points to bear in mind are: Number 1. Remain calm. It's not personal, it's about them and what they're feeling right now. You can help. Number 2. Hurt. Understand that anger is a sign of hurt, physical or emotional. The patient is hurting in some way. It may be nothing to do with the practice, but you can still help. Number 3. Acknowledge that the person has a valid cause for upset. Show empathy. It's understandable that they might be angry, but not aggressive. If they can help you understand the cause, you will do your best to help. Number 4. Plan. You can help the patient develop a plan for them to start to reduce the hurt. Number 5. Promises. Keep your promises to the patient and follow up with them when you said you would. At the same time, you need to be honest about what you cannot fix. Remember, some people have selfish or critical personalities, and you're unlikely to be able to change that. This guide is about de-escalating a tense situation. It's not counselling for the self-absorbed. Your objectives when dealing with an angry patient. When dealing with an angry or agitated patient, your objectives are: 1. To de-escalate the situation. 2. To find out what the issue is and help the patient find a solution. And 3. To minimise disruption or upset in the practice. To start towards these aims, let's consider the main causes of anger. The causes of anger. We can remember the 5 most common causes of anger for patients using the mnemonic I-GASP. Intoxication. Your practice should have protocols for dealing with intoxicated patients, and we do not cover that in this guide. Grief. The patient has received, or thinks they're about to receive, bad news about themselves or a loved one. Anxiety, or a feeling of loss of control. For example, a long wait to be seen when they're worried about what's wrong. Stress or fear. For example, if awaiting test results or other medical news, or if they already have a serious diagnosis and are awaiting news of further action. Pain, particularly if the patient feels they can't understand or control it. These causes of anger may become manifest in practice when, for example, a patient who is seriously concerned about their health or that of a loved one has to wait an extended period of time. A patient hasn't got what they were wanting to get, for example a referral or the prescription they wanted. Or they disagree with the guidance they've been given. Perhaps they've read something different on the internet, or were told something by a friend. A patient who feels they're not getting the urgent attention that they feel they need. A patient who's experiencing personal or emotional stresses, such as relationships, work, debt, etc., and feels that things are spinning out of control. A patient who's suffering mental health difficulties and is unable to express themselves effectively. Be aware that a busy, overheated waiting area can ramp up any existing stress or anxiety. Principles for dealing with anger. As we've seen, anger is an expression of hurt, physical or emotional, often linked to the stress of being unwell. Our aim is to help the patient translate the hurt from anger to a plan of action to do something about it. The following 6 principles can help us start to get to grips with this anger. Number 1. All behaviour is communication. An agitated or angry patient is trying to get something across. They're just not communicating it rationally. You can help them communicate better. Number 2. Anger is an expression of hurt, physical or emotional. Don't try to stop the anger. It's a genuine and valid emotion. Rather try to diagnose the hurt that is causing the anger. Something is wrong. Your job is to identify the issue. 3. It's not personal. It's about them and what they're feeling right now. However, the practice may have messed up in some way, so be ready to apologise for that and rectify the situation. 4. In many cases, the anger relates to the personal circumstances and life challenges of the patient. There may be little medically you can do, so what other support can you refer them to? 5. Patients with mental health problems or dementia often find it more difficult to identify what their problem is or to control their feelings. They may be tired, hungry or thirsty, and finding it difficult to communicate their need, or have been unable to attract attention. Be considerate towards them. 6. Loud noises and rushing about, not unusual in a medical setting, can exacerbate a patient's feelings of distress or lack of control. If you can, take the patient somewhere quieter. Warning signs. Your practice is running behind schedule and the waiting room is busy and noisy. Anyone who's already stressed or anxious may be nearing the tipping point. It's better to identify the warning signs early and intervene before anger is expressed. Agitation. A patient is looking impatient. They might be restless, fidgeting or showing signs of muttering to themselves. Face. A patient is looking flustered, becoming red in the face. They're not making eye contact and they're looking increasingly agitated. Voice. You speak to the patient and their voice has an edge to it, perhaps slow, deliberate and pointed, or possibly rising with anger. Physical. The patient is coming too close. Their hands and arms may be moving about animatedly. Fingers may be pointing. You might not see all of these things, but you'll notice discontent building. It's best to build a relationship with the person before it moves from agitation to anger. Mr. Bloggs, I'm sorry that you've had to wait. We had an emergency earlier which put us behind, but your appointment should be called in the next 15 minutes. And make sure it does come up in the time frame given. Or, Mr. Bloggs, can I ask you to come into this consulting room, please? If you can, get a nurse or another member of staff to come with you and start to de-escalate the situation, following the steps below. Prepare the practice for the inevitable. It's inevitable that you'll get angry patients from time to time, and there are things the practice can do to prepare for that. Have a behaviour policy. Prepare posters for the waiting area about aggression and abuse towards staff. Make sure every member of staff understands the behaviour policy and how they should act. Train staff and role play in training sessions. If possible, plan a room that can be used if there's a problem patient. Prepare the room by keeping it tidy with seating. Consider installing a panic button. Discuss staff roles. Who will deal with the angry patient? Who will be backup? And what is their role? For each shift, is it possible to have a trained lead who will intercede with any difficult patient? There should also be a backup who knows what support to give if necessary. Refresh your mental health training and awareness. Review your plans for dealing with intoxication. Things to avoid with an angry patient. Most of the things to avoid with an angry patient are common sense and easily summarized as: don't poke the bear with a stick. Don't reflect the agitation or irritation back to the patient. An authoritative style of addressing the issue will likely aggravate the patient further. Don't say, just calm down. It devalues their concern and makes them feel even less in control. Likewise, don't say, sit down and we'll get to you as soon as we can. Don't challenge the patient's interpretation of events or criticize them for their reaction. They feel they have a valid complaint. Don't tell the patient to be quiet or hold on. Don't use confrontational body language, such as pointing fingers, arms crossed, etc. And don't raise your voice if the patient raises their voice. Don't get angry, even when the patient questions your credentials or competence. Don't interrupt a patient's or relative's outburst. Let them get it out, preferably in a private room. Don't get defensive. It gets the patient's back up. We've been doing our best. Don't you realise how busy we are? Don't be manoeuvred into an argument or a pantomime, oh yes you did, oh no you didn't, tit-for-tat exchange. Don't deny reality, no matter how painful it is for the patient. Work from a place of honesty. Don't block the patient's way, or talk to them from behind, or try to pacify them by touching them. Don't take it personally. A person's anger is not about you, it's about them and their emotions. Don't use the word but. It's like a big barrier for the patient and another sign of your lack of understanding of their concern. Use and instead, or be more circumspect. Don't accept abuse. I understand there's a problem, but please don't be abusive. We can't tolerate abusive behaviour. Tell me more about what's upsetting you. 12 steps to dealing with anger. You have an angry patient in front of you. Now's the time to practice what you've been rehearsing. Number 1. Remain calm. Don't take the anger personally. It's inevitable that some patients will treat you disrespectfully. Reacting negatively will only escalate the situation. Number 2. Acknowledge that the patient is upset and validate that they have the right to be frustrated. Assure them that you will take their concern seriously. Number 3. Take the patient to a quiet area, away from onlookers if you can. Be aware of personal safety and make sure that other staff know where you are and that you are in earshot if you need to call out. If the practice has a portable panic button, take it, but keep it out of sight. Sit the patient down and sit next to them, not in front of them. 4. Listen with intent to understand and help. Listen to the patient's problem and talk it through with them. Thank them for talking to you about it. Number 5. Show empathy and understanding. Look at the issue from their point of view. Ask pertinent but neutral questions to clarify understanding. Number 6. Reflect the issue back to the individual in your own words to show understanding. Ask them if they agree. If they do agree, then this should take most of the heat out of the situation, and you can move to step 7. If they don't agree, continue with steps 4 and 5. Number 7. Apologise if some of the issue is the practice's fault, and correct the problem immediately. Number 8. Make promises that you can keep, but be realistic about the things you cannot change. Number 9. Ask for help from other staff members if you feel you need it. If the situation looks like tipping over into physical aggression, give a warning in a calm but resolute tone. If possible, calmly call for expert help, for example the police. Number 10. Agree the action you will take, follow up promptly, and get back to the individual within the agreed time frame. Even if you haven't made progress in the time agreed, get back to them to apologise and ask for more time. Number 11. Agree a conclusion and any further action plan. A follow-up appointment or call is often useful. Number 12. Take a break when it's all over to settle yourself. Questions that can help. Use a gentle questioning approach to try to understand the root of the problem. Keep the questions open and neutral. Remember the 5 causes of anger, I gasp, and use your questioning to identify which route to follow. Useful questions include: Are you in pain? Where does it hurt? Are you feeling unwell? If the problem seems to be medical, consult the duty clinician if possible, and arrange an urgent acute appointment in accordance with practice policy. What's upsetting you? Will you explain your concern to me, please? If the problem is bad news, for example a difficult diagnosis, consider social prescriber or other appropriate intervention. If the problem is anxiety or stress, consider getting the duty clinician involved or offering an urgent initial telephone consultation. But be careful not to allow the patient to jump the queue. It may lead to repeat behaviour in future. Consider if the patient can wait in a separate area or in their car and phone them a few minutes before their appointment. If the problem is related to personal problems, refer to the appropriate agencies. If possible, make a call on behalf of the patient to get an initial appointment. Consider social prescribers, voluntary organisations and support mechanisms. Make sure your practice maintains an up-to-date record of relevant support organisations. Can I get you some water? Dehydration can intensify agitation, so it's worth offering water. It also, literally, helps them cool off a little. Are you having problems at home or at work? Often the person's anger may be fueled by problems in their personal life. Can you refer them to any organisations for help? How would you like the situation to be resolved? You put the ball in the patient's court by asking them how they would like things to be different. You may not be able to agree to all of their proposed solution, but you should try to meet them part way, and the patient feels that they're being dealt with on their terms. Be aware that the patient may have mental health difficulties or may have difficulty explaining themselves. Be patient and respond according to the training and experience you have with such patients. Distraction. It can be useful to distract a patient from their anger for a while. It takes their attention away from themselves and can help cool things down. But be ready to retreat if it irritates them further. Tips include: use the patient's name. Mr. Bloggs, can I call you James or is it Jim? Say something personal if you know the patient at all. How is the garden looking? Isn't your son or daughter coming up to their exams? How is your son or daughter getting on? I haven't seen you out with your dog for a while. Apologise if things got off on the wrong foot or you think part of the issue is related to the practice. Appointments are behind because there was an emergency earlier. Explaining the reason behind any delay can help take the patient's attention away from themselves. We had a suspected heart attack. An ambulance had to be called. A lady went into labour, and so on. Set boundaries. I understand you're angry and I want to help. Please don't be abusive. Keep it calm and respectful, and not confrontational. Politely ask the patient not to use bad language, for example. Bear in mind your practice's behaviour policy and summon help if you need it. If the patient doesn't want to be distracted, they'll likely say something like, I don't want to talk about that. I want... You should then retreat gracefully. I'm sorry, I was trying to be friendly. I know this is important and I want to help. Tell me what's upsetting you. Example script elements. It's impossible to cover every scenario. Here are some starters for your discussion with that angry patient. Mr. Bloggs, I can see you're upset and I'll do my best to help. I'm sorry you've had to wait. We had a patient emergency earlier and that held up all the appointments. We had to call an ambulance for the patient. Now, tell me what's upsetting you. I'm really sorry to see you're upset. I'd like to help. Let's discuss it over here. What's causing the problem? Are you in pain? Where does it hurt? I can see you're upset. Can I take you through to the room there where we can talk in private? Can I get you a drink of water? Take the patient into the private room, sit them down, sit next to them. Tell me what's upsetting you, Mr. Bloggs. What can I do to help? I understand that you're worried. I'm sorry we're running late because, and explain the hold-up. I can get a doctor or nurse to call you between X time and Y time if you don't want to wait any longer. Make sure the clinician does call back, though. You have a right to be angry, Mr. Bloggs, and I apologise if there's anything we've done that's made it worse. I want to help you. Talk me through what's wrong. I can see that you're angry, Mr. Bloggs. I'm sorry. Tell me what the problem is and I'll do my best to find a solution. Tell me what's upsetting you. I agree it's frustrating. How would you like to see the situation resolved? I'm afraid we can't let you ahead of other patients, or any other request you cannot agree to. As a compromise, how about we book you in for the first appointment on Thursday, or other counter offer? In summary, you deal with an angry patient by being in control of yourself. Remain calm, show empathy, and acknowledge the patient's valid concern. Bring the temperature down by gently and sympathetically exploring the issue with the patient to determine the cause. Keep it friendly and professional. Reflect back your understanding of the problem and ask them to agree that you've got it right. Agree a plan of action with the patient. Keep your promises. Be honest about what you cannot fix and follow up with the patient when you said you would. Dealing with rude patients. The approach we use to deal with a rude patient is very similar to that for dealing with an angry patient, but thankfully is usually less stressful. The steps we use with an angry patient can also be used with a rude patient. Stay calm, show empathy, explore the issues, agree a plan and stick to it. A patient might be rude for a number of reasons. Number 1, they're dissatisfied with the service they're receiving. The patient may be rude because they're heading towards anger at some perceived failure in the practice's service. There might be many reasons for this, including a delay in getting an appointment and then having to wait a long time to be called. They may also feel that their issue has not been taken seriously or not addressed in the way they wanted. Some of these reasons may, at least partly, be the practice's fault. The best approach is to be calm and polite, explain the situation, and apologise, taking corrective action as necessary. Number 2, they're having a bad day. Anger, as we have seen, is an expression of some physical or emotional hurt. Rudeness can be similar. Things unrelated to the practice might be going wrong for the patient at the moment. Again, the best approach is to be calm and polite. They might appreciate a sympathetic ear, or you may be able to refer them to social prescribing or other support such as citizens' advice. They're anxious. The patient may be worried about the issue they're attending the practice for. They may fear that they have a serious illness or are anxiously awaiting the results of tests. Their rudeness is not about you, it's about their fear. Be calm, polite, and sympathetic. They're indecisive and they don't like to be rushed. General practice is always busy, but some people like to take their time. They have a personality type where they like to have time to consider the options. They may change their mind often or put off making a decision. The busy pace of the surgery doesn't suit their personality and it can make them snap. Be aware that some patients need longer to make up their mind than you have to deal with them. Be patient. If you can, let them stand aside and come back to them after you've dealt with the next patient. Some people think they're better than you. Yes, it's true, some people have a superiority complex. We've all met them. Some people just think they're better and they know better. You can't change a person's personality in the brief time you have to interact with them, so you just have to bear it. The solution is to stay calm and above all, be polite. If you get irritated at their rudeness, that will simply reinforce their feeling of superiority and power. Instead, be charming and graceful. In fact, it can be quite fun to be flatteringly charming in the face of the rude patient. It takes away their power. Suddenly you have the power of grace in the face of rudeness. Often that will deflate a patient's rudeness, although it might not. Just be satisfied that you didn't rise to the bait and didn't fall victim to their desire for power. Some people are just rude, but often a person's rudeness is a sign of underlying stress. Be sensitive to that. Politeness and empathy are the best approach. And when you meet that patient with the superiority complex, deflate their power with your charm and grace. I hope this information will help you deal with angry or rude patients better. Be ready for that next crotchety patient. Good luck.